Management of post-operative bleeding, systemic and local. Bleeding disorder, these are conditions that alter ability of blood vessel, platelets, and coagulation factor to maintain hemostasis. We have two types of bleeding disorder: inherited bleeding disorder or acquired bleeding disorder. The management of post-operative bleeding during all surgical procedure depend on if the patient is hematological normal or if suffer from some disturbance in the normal clotting mechanism. The uncontrolled and persistent bleeding can occur in some healthy patients after dental extraction. Therefore, it's still important to achieve proper hemostasis in all patients during oral surgical procedure to prevent excessive post-operative blood loss. Hemostasis. The word of hemostasis broken down into hemo and stasis. Hemo, which means blood; stasis, which means stop. So together make the response of the body to stop bleeding. Keeping the blood within damaged blood vessel is involve number of events. First, vascular phase, which means vascular spasm. 2, platelet phase. 3, coagulation. 4, fibrinolysis. The platelet phase mean primary phase, coagulation, which is secondary phase, fibrinolysis, which is tertiary phase. We start with vascular phase. This phase immediately begins after the injury, which involves vasoconstriction of the artery and vein in injury site. And then the platelet is aggregated at the site of the injury of a blood vessel to form plaque. This is called platelet phase. Coagulation phase through two separated pathways, the intrinsic and extrinsic. The common pathway have two phases: one, prothrombin conversion to thrombin; 2, fibrinogen conversion to fibrin. This fibrin is tightly bind to platelets to form clots. And then fibrinolytic phase, which means lysis of fibrin. The fibrinolytic is needed to prevent coagulation of intravascular blood away from the site of the injury and to dissolve the clot once it has surfaced its function in hemostasis. The main enzyme is responsible for this process is plasmin. As we said, primary hemostasis means vasoconstriction and platelet adhesion and aggregation to formation the blood. Secondary hemostasis means activation of a coagulation factor and formation of fibrin. Tertiary hemostasis means activation of fibrinolysis. As we said, in coagulation phases, we have two pathways, intrinsic and extrinsic. The common pathway have two phases: one, prothrombin conversion to thrombin; fibrinogen conversion to fibrin to formation the clots. Hemostasis depends on vessel wall integrity, adequate number of platelets, proper function of platelets, adequate level of clotting factor, and proper function of fibrinolytic pathway. Bleeding in oral surgery. Hemorrhage following oral surgical procedure can occur due to the local or systemic cause. In healthy patients, the post-operative bleeding is mainly due to the local cause. Local cause, we have two types, either soft tissue or bone. The local cause soft tissue bleeding is either arterial, venous, or capillary in nature. Arterial bleeding, like this photo, is bright red and sporting in nature. The artery in soft tissue at the risk during oral surgical procedure, which lie in posterior portion of heart palate, which is greater palatine artery and buccal artery. Venous blood, like this photo, is dark red in color and follows steadily and heavily specialized if the vein is large. Capillary bleeding is a bright red in color and is more of minimal OC. Bony local cause. Troublesome bone bleeding originated from a nutrient canal in alveolar region, central vessel such as inferior alveolar artery, or from central vascular lesion such as hemangioma or vascular malformation. Like this photo, we have injury in cortical bone plan, surgical bone removal or traumatic bone fracture, and we have granuloma. This is cause is local bony or bony local cause. Systemic cause of bleeding in oral surgery, such as some patient with hereditary condition such as hemophilia, patient with thrombocytopenia, which means decrease in platelet count, or leukemia, patient with uncontrolled hypertension, patient with prosthetic heart valve replacement or stroke, or patient who take oral anticoagulant like aspirin or warfarin. These patients are also at the risk of prolonged severe bleeding during and after oral surgical procedure. The type of the bleeding: primary bleeding, reactionary bleeding, and secondary bleeding. We start with the primary bleeding. This occurs during the surgery as a result of injury like cutting or laceration of the artery. This also occurs when the surgery is done in infected area with a lot of granulation tissue. It can also occur after a very short period of the time immediately after the surgery. This type of bleeding is really normal and can be controlled easily. The second type, which is reactionary bleeding, the type of bleeding occurs within a few hours after surgery, not immediately like primary bleeding. This type of bleeding occurs as a result of failure of coagulation to occur, such as in patients with systemic bleeding problem or those on anticoagulants. Patients who have unload disturbance or dislodgement the clot are also prone out for this type of bleeding. Secondary bleeding, this occurs after 7 to 10 days after surgery. This is mainly due to the partial division of the blood vessel in combination with the infection of the wound, like patients who undergo radical neck dissection. This type of bleeding is not very frequently encountered after oral surgical procedure. The management of primary bleeding in normal patients: first, use pressure swab to achieve hemostasis, and then ligation of blood vessel with silk suture. Use electrocategory to achieve hemostasis. Use hemostasis agent like bone wax and hypertensive anesthesia, and use vasoconstrictor in local anesthesia. Local measure synthetic material. There are several materials that are commercially available that are used locally to achieve adequate hemostasis. We have oxidized regenerated cellulose, gel form with activated thrombin, microfibril collagen, bucket collagen, tranexamic acid, which is used for irrigation. Clinically, we start irrigation of wound with tranexamic acid, and then suturing of the wound, pressure with oral pack. The management of reactionary bleeding in normal patients. The management of bleeding that occur immediately after surgery, reactionary bleeding, involve proper examination of the surgical wound to identify the site of the bleeding, which is bone or soft tissue. 1. If the bleeding is from bone, then the hemostasis agent like bone wax or gel foam is used. If the bleeding is soft tissue, then ligation or catheterization of the blood vessel along with use hemostasis agent like surgical and suturing of the wound is carried out. The management of secondary bleeding in normal patient. The management of this type of bleeding that occur a few days after surgery involve removal any diapers from the wound surface that promotes the infection of the wound, and identify the source of the bleeding and treat as would be done in patient with secondary bleeding, and then surgical stent can be placed over extraction socket for stabilization the clot and prevention of wound contamination.